heard about the bike accident that the son of our amiable president was in. We're talking about Yusuf Buhari, and he sustained injuries to his head and some parts of his body. And we also learned he's been quietly flown out of the country. Now, this has raised a debate on social media as to what happens to the rest of Nigerians who cannot afford to travel abroad to access treatment. Now, according to the President Healthcare Federation of Nigeria, Mrs. Claire Omaseye, last year, she disclosed that a total of $1 billion is lost annually to medical tourism in Nigeria. Let's talk Mutiat. You and I, when we have a headache, we can't afford to.
I go to the nearest health center.
To the nearest health center. All right. So, but this penchant for prominent Nigerians to always, there's nothing wrong with you doing what you like with your money. But if we are in a government that's talking about leading by example, you want to see certain things, you know, being done and certain things not being done. And one of them is when you're sick,
you want to go abroad.
Do you understand? Get treated here, because millions of naira pass through you into your state. What do you do with it? So there are lots of questions.
Yeah, I think for me, the present government is not doing justice to that. You promise Nigerians a lot of things, but you on your own part, you're not fulfilling it. Not everybody can have access to go abroad for medical treatment. But as a government, it is very, very important. You lead by example. What happens to our general hospitals, our state hospitals, our federal hospital? Do you mean our medical doctors there are not good enough?
Have you been to a general hospital recently?
Of course.
Yeah, they don't have anything. Apart from maybe what you see in terms of solid infrastructure like beds, and they don't have anything in terms of drugs.
So does that mean, does that mean the present government is not doing more in place of providing more infrastructure? You know, some of these equipment that are needed. Does that mean the hospitals abroad?
We need to
does that mean the hospitals abroad are better off than our own medical experts in Nigeria? For crying out loud, we have lots of good medical doctors. I, for one, proclaim my brother as one of the best medical doctors because he's doing his work so well.
So what are we lacking? We have the manpower. Mr. Dioya, what is the issue?
Well, first, the original question you asked was, when you are sick, what do you do? Okay, so what do we do when we are sick in this country? We pray. You know, and let me tell you something. There are two ways to look at this. We can continue to blame government. But we know we have a government that has not learned to care for the citizenry over the years. We'll be complaining about it all our lives. It has not changed. It's not likely to change. But what do we do when we are sick? We pray. When your uncle is sick, what do? You pray. When your mother is sick, you pray. When your son is sick, you pray.
You pray for what, really? For them to get better?
You pray for them to get better. You pray for miracle.
Wow,
you go to church, you carry the people who carry mortally sick people to the church. And they take people from hospitals, they take them to church. They take them to the beaches in the night, they take them to the shrines. And when I say shrine, not the herbalist shrine. No.
Okay.
Because the herbalist does not operate in a shrine. The herbalist operates in his own clinic. Let's call it clinic, a traditional clinic.
Yes.
The shrine is for the occultists. Or sorry, the worshippers of some I don't know if you... So, this is what we do. So, the answer to that question is very clear. The question we should be asking is it time for us to change that attitude?
Okay.
In America, some of the most forward-looking, some of the most advanced, some of the most technology-driven hospitals are owned by churches. Methodist Church, and all these churches, they invest massively in healthcare. Guess what? They make a lot of money.
Yeah.
So when we say sit down here and say we're discussing medical tourism, actually we are not discussing medical tourism, we are discussing medical survival of Nigerians. Because after you survived, then you advance, then you become efficient, then you get to a high level of efficiency. We are looking for people to come in from outside to come and enjoy that. That's when you are at the level of medical tourism. But here we're even talking of, look, how do we want to treat ulcer? How do we treat malaria? We can't treat malaria. People are dying of malaria in this country.
Very true.
So I would say maybe with those of us in the media, in public or whatever, we should move the conversation slightly away from government and begin to ask the question. A church that can raise 10 billion naira in one day to build some church building. Why can't they put that money in a hospital and save the souls of thousands
Save
of people?
lives.
Save lives.
Yes.
Okay.
And make money too.
And make money from that.
And then you can then use that money to build a bigger church. I mean, so right now on the street I used to live in Magodo, there were 3 or 4 churches on that street. Yet each time somebody falls sick, they pray. Why don't we move the investment away from? I think we have enough churches. We have enough mosques, I think, but
Yes.
not quite close to the churches. But I think we have enough churches now. Is it possible for us to now begin to move the investment
From the government
yes,
to
so
church,
that,
yes.
no, not from government, from church
Church.
to health
Okay.
Okay.
and
Okay.
perhaps education too. So I think that could solve a lot of problems.
I hope we don't have like a replay of what we already have in the education sector, where the churches now have their own education institutions, and then they cannot be accessed by the masses. You know
Let's
what I
start
mean?
from somewhere. You see, there are some of the church-owned universities that are quite useless. Trust me. But there are some of them that are very, very good, even though they have all these unnecessary moral issues that they harp upon.
Yes.
But there are some of these universities that are quite good academically, and they are breaking barriers and doing things in a fundamentally new ways. So it's a step forward that we won't have those institutions from primary to secondary to university. It will get better. There will be competition among them. They will grow bigger. They will get more students, and eventually they will realize that they have to compete with the best in the world. They now need to move into health.
Okay.
I think if they move into health, 10 billion, 20 billion, which can be raised by some churches in 2 days, you put it in an hospital, I think you get a fairly good hospital.
All right, Akinyele.
But the biggest challenge that we've had is infrastructure. There are people, at least we have people that go to medical schools. Every year there's thousands of people that graduate from medical school. They learn, either they know or they don't know. We don't know, but they learn, they came out. And some of them are practicing, some are doing very fine.
Yeah.
There are people that have personal doctors and everything out there, and they're living healthy.
Yes.
I think the biggest struggle is sincerity of people to the society we live in. There are some rich men, like he said, that can build a big hospital standard that will be assessed by who can afford it. Good healthcare is expensive. You can't be expecting good healthcare to be cheap. Anyway, you want to be healthy, then you live healthy, or you do unhealthy things. I'm going to pay money to go and keep yourself healthy.
And maybe that's what a lot of people, and maybe that's what a lot of people prefer to probably just go to the church because it's pretty cheap for them.
But what is there a machine that opens your system in the church that removes
touches
that
you.
skin element? For me,
But some churches are actually
I
doing
think
well.
it's a belief thing in. It's
What did you say, Mutiat?
No, I said some churches.
Uh-huh.
At least I know of Paul Adefarasi in House on the
House
Rock.
on the Rock.
Okay.
Yearly, even in medical and education-wise, he goes to some local governments, healthcare,
Okay.
and donates
But
facilities.
the main thing
Facilities.
is, do they actually get those things down to the patients that
Does
actually
it
need
get
care?
that exactly?
You know, most of
Does
the
it get to the
public
people that need
medical
them?
practitioners, they have their own private clinic. I'm not trying to say they would have to move. No, you don't get what I'm
Okay,
trying to
do
say.
you know at times this thing also boils down to, will I say, human management.
Okay.
I give you an example. While I was serving in Bayelsa, I served in Amasoma. And as part of my personal community project, I visited I think 5 riverine communities. And one of it was Torebeni and Amatolo. They have a good health care facility there. But it's so painful that when these drugs comes, it doesn't get to the health center.
That's
And they as cheap as paracetamol is so much expensive. It's not like if I go with a particular drug, let's say malaria drug, to some riverine areas in Bayelsa, I'm like the princess there because I have something they all need.
Wow.
But when we say good health,
Interesting.
when we say good health infrastructure or whatever we call it, I think you don't understand what these big men think of. They think of technology. Their headache can be cured by a machine touching their head and disappear in the obodo imbo. But in Nigeria, someone will be dragging them with injection
A syringe,
or look
yes.
for something to put in their system.
Yes.
So I think these big men that run abroad, they know what they run abroad to get. They know if they come to our local guys and okay, sorry, maybe our doctors them they don't have that technology that they see outside.
Outside.
There. So that's why I said it boils down to we people here to start being sincere with ourselves and look at ourselves and say, I care for this next guy. If I have something that will help this next guy, and this is where the church comes into the picture. If they can raise that.
Okay, let's go back to the big question. Pending the time the churches maybe will get involved with healthcare.
Everybody, not churches alone. Everybody.
Yes, with healthcare.
Every
What
man.
should the masses be doing to help themselves?
They have to pray.
Apart from
We
praying,
should keep praying.
praying for miracles.
Yes.
Stay out of Wala.
they have to keep praying because, I mean, if you look